A self breast examination is very important. You shouldn't skip that. She is sexually active. She must continue doing the pap test every 3 yearly.
So, when does a gynecologist refer to an oncologist?
He can have like cervical discharge. That's a very difficult situation. It can be prevented.
All right.
So there is a vaccine, HPV vaccine. They try to figure out the gender of the baby, getting from the shape of the belly.
So, what are the important markers that a woman needs to check even before trying to have a child? What are the tests that she needs to get done?
That's a crime. That's a crime to do that.
What would be your golden advice to every girl, every woman that is watching? Hello and welcome to OTV English podcast. Today, we are going to discuss a topic that is related to a woman's overall and reproductive health. From menstrual cycle to pregnancy to PCOS to fertility issues, every aspect is related to gynecological health of a woman. Today, we have among us Dr. Samikshya Nanda to discuss the topic in elaboration. Let's welcome Dr. Samikshya Nanda to the show. Welcome to the podcast, ma'am.
Thank you.
Ma'am, oftentimes we see women struggling with reproductive health, be it with their menstrual cycles or be it painful menstrual cycles. So, aside pregnancy, what are the must have checkups or the must have information for women regarding their gynecological health?
So women's gynecological health, it is dynamic. It has multiple variables depending upon the which stage of life she is in. So I am basically speaking about the reproductive years. So there she needs to undergo pap test, which is done every 3 yearly. Once she is sexually active, she must continue doing the pap test every 3 yearly. Then she has to do breast examination. It can be done by self, can be done by a clinician. If she is doing it by herself, then she needs to do it every month after during the periods or after 1 to 2 days of a cycle. And if she is going to any gynecologist for clinical breast examination, she should go annually. Then pelvic examination, if she is experiencing painful periods, heavy menstrual flow or irregular periods and she is sexually also active, then she must undergo pelvic examination once a year. Apart from that, if she is older than 40 years of age, routine mammography once a year is recommended. And routine blood tests like thyroid profile, blood sugar and hemoglobin estimation, they need to be carried out every year. I will like to speak more about pap smear test because
I was just going to get there
Yeah.
because can you please elaborate on what is a pap smear test? Because regarding these things, women are only taught about in households as well. Women are only concerned about pregnancy or in general their menstrual health, but they do not know the tests circling around them. So can you please elaborate on it?
Yeah. So pap smear test is basically a histopathological test where we get a smear of the cervix. Okay, we get a scraping of the cervix. Cervix is the lowermost part of the uterus. Okay,
Right.
we get a smear of the cervix and we study those cells under a microscope to find out if there is any abnormal or precancerous cells.
Okay.
Because cervical cancer is a thing which begins much before the clinical symptoms arrive. Okay,
All right.
so it has a long latent phase, like around 10 years. So if we are doing pap test every 3 yearly, so it becomes easier to pick up some abnormality if there is in the pap test.
Okay.
Plus, there is a test for HPV, which is human papilloma virus.
Yes.
It is a notorious virus. It gets transmitted during sexual contact and it is mostly responsible for cervical cancer.
Okay, so it is different from HIV. How?
This is not HIV. This is due to HIV can be transmitted by any body fluids.
Right.
Okay, but human papilloma virus, it is mostly transmitted through oral mucosa, oral mucoid
Okay.
secretions and
Okay.
vaginal secretion and anal secretions. So it is different from HIV in the sense that it doesn't cause what HIV causes.
So
HIV
it can be cured?
it cannot be cured. So
Okay.
it can be prevented.
All right.
So there is a vaccine, HPV vaccine, which has also been licensed by the government of India. It can be prevented provided the woman take the vaccine prior to sexual activity.
Okay, so just a little bit of confusion over I have. there are vaccinations for prevention of cervical cancers.
Yes, yes, yes.
So is this the same vaccine as that?
Yes, yes. This is the
Okay,
same vaccine as that. This is HPV vaccine. It
right.
covers, there is two types of vaccines are available in the market. One is a
Uh-huh.
double strength vaccine and another is four strength vaccine. So one vaccine which is widely popular in India, it covers four strains of HPV virus. Okay.
Okay.
So those four strains are mainly responsible for causing carcinoma cervix. Okay.
Okay.
So by providing the vaccine earlier, we develop antibody against that virus so that
Okay.
women before undergoing into any kind of sexual activity are already protected against cervical cancer.
So women who are already sexually active, there is no there is no
uh,
need for them to get this
no,
vaccination?
they can also get the vaccine. It is recommended till the age of 45 years,
Okay.
but it does not assure that we do not know whether she is affected with HPV or not. It is not
Okay.
clinically symptomatic all the time. We
Okay.
can give the vaccine, but we do not know whether she is affected with HPV or not.
Okay.
Okay,
So what are the
so
symptoms of HPV?
actually, HPV doesn't manifest as such.
Okay.
She can have symptoms, but she cannot have. She may be a carrier. She cannot have symptoms. So she can have like cervical discharge, vaginal warts, anal warts, and she can have pre-cancerous lesions in the cervix. But these things are not apparent with anyone who is affected. So if there is
Okay.
a long latent period of HPV infection in a woman, she can present with the features of all this. But
Okay.
it is not mandatory for all to present like this. So she can be infected, but we may not know that.
Okay.
Okay.
So, for an example, if a woman establishes a sexual relationship with a person and then that person gets involved with someone else, so is there a possibility that the HPV gets transmitted through this?
Yes,
Okay.
the HPV gets transmitted through this, and the one of the risk factors is multiple sexual partners,
Right.
early age of sexual intercourse,
Right.
multiple pregnancy. These are
Mm-hmm.
all the factors related to high risk of cervical cancer, and
Right.
HPV gets transmitted through all these sexual activities.
Okay. So there is this thing that you mentioned about taking a small smear of the cervix. So is that a small tissue that is collected?
No, that is not a tissue exactly.
Uh-huh.
So there is some kind of mucoid discharge all the while inside our vagina and cervix. Okay,
Okay.
that is the thing that keeps our vagina and cervix moist all the time.
So is
Okay,
it like a swab
it
test?
is like a swab test, but we insert something like a ice cream stick
Ha ha
and we
ha.
take the scrapings. It is not painful.
Okay.
Okay, we
Yeah.
take the scrapings and we put it as a smear on a slide and
Right.
then examine it under microscope to find any kind of abnormality or precancerous cells.
Yeah, I think this was very much helpful for our viewers because everyone gets scared thinking that taking a little bit of tissue might be
No.
painful or cause
Okay.
some pain later in the life. Or, in fact, there are so many myths circling around these examinations that this could affect fertility, this could affect pregnancies in the long run, or, in fact, induce miscarriage. So, these are the things that actually concern women. So, I think this was a huge insight for them.
Yeah, and this is not painful. It can be done by self also. There are self
Okay.
testing kits are also available. She can
Okay.
take the smear and she can dip it into a solution. So the
All
cells
right.
are collected and the cells can be examined later on.
So the person who does this test at home can send the collected sample to the lab to get tested.
Yes, yes.
Okay.
She can collect the sample herself, but she needs to send it to the lab.
So is there any stipulated time that the sample needs to get sent to the lab?
No, actually, it is a liquid based cytology test. There is already a liquid
Uh-huh.
inside the tube. So, we need to put a sample inside that. The sample is stable inside that. We can transfer it to the lab after 2 to 3 hours, not a problem.
So are there any other information regarding the pap smears test that we need to know?
Oh, okay. So, pap smear should be done every 3 yearly, starting from the age of 21 years.
Okay.
Or after the woman gets sexually active.
Mm-hmm.
We can do it every 3 yearly. And we can combine with that HPV test, which is again a smear from the cervix, which examines the HPV virus, whether it is present there or not.
Okay,
Okay.
so pap smear and HPV are two different
Different.
tests.
Pap-
Okay.
Oh, yeah.
Yeah, okay, okay.
HPV virus, when affects the cervix, it initiates certain changes in the cells, which
Okay.
get picked up in the pap test, whereas
All right.
presence of HPV directly can be confirmed by a HPV test.
Okay.
So we can combine these two tests together.
Uh-huh.
When done together, this can be done every 5 yearly.
Okay.
So if you are doing pap test alone, we need to do it every 3 years.
Okay.
So when we are combining it with HPV test or we are eliminating the pap test and doing the HPV test only, then we need to do it every 5 yearly.
Okay.
Okay, starting from the age of 30.
Okay.
And we need to continue it till 65 years of age.
Uh-huh.
After 3 negative reports, we need to stop that.
Okay.
And even if the woman is everything is good in pap test, HPV is negative,
Mhm.
still also the woman needs to undertake the vaccine, and vice
Okay.
versa. Even if the woman undertakes takes the vaccine, she needs to undergo pap test and HPV test.
Okay, okay,
Okay.
all right. Because, even I did not know about all of these
Yeah.
things. There are so many women we do not know about these things. These are, I think these should be taught in schools as well. Doctors should
Okay.
conduct, these health camps where especially girls are taught about these things. Because I'm currently in my mid 20s and I'm getting to know about these just now.
Okay, but this has been recently included by government of India in a
Uh-huh.
pilot project where they are providing HPV vaccine. They are providing only single dose of HPV vaccine to girls who are more than 14 years of age.
Okay.
So this is a pilot kind of study. They are doing it for 2 to 3 months. So gradually things are going to be normalized. There is awareness about it, and most of the people are these days are taking HPV vaccine.
Okay, so I would like to ask you one thing that
Hmm.
I think there will be many women who will be concerned about it. That are the vaccinations safe, or are they going to affect the fertility or pregnancy in any way?
No, these are safe, but we need to postpone the pregnancy after 1 month, 1 month after the last dose. Okay.
Okay, okay. So if a person takes the first dose and then the second and third and fourth, up until during that period, the person cannot get pregnant or should not get pregnant.
There is no that much literature is available about pregnancy while taking the HPV virus, but it is not recommended to get pregnant during that period. There are usually 3 doses after 14 years of
Uh
age.
huh.
So 0, 1 to 2, and 6 months. 3 doses are there. After the sixth month dose, that is the last dose, gets finished, she can plan pregnancy anytime 1 month after that.
Okay, so the entire duration of the three vaccinations is 6 months.
6 months. Yeah.
Okay, so they will be administered during this period of
Yeah.
time, and after 1 month of completion of
Yeah.
the entire vaccination course, the woman can prepare herself for pregnancy if she wishes.
This is a dictum. After any vaccine, we
Mm-hmm.
need to give her a period of 28 days at least, that is around roughly 1 month,
Mm-hmm.
before she tries to conceive. After MMR vaccine, after giving her HPV vaccine, after giving her yellow fever vaccine, we need
Okay.
to give a period of 28 days.
Uh-huh.
After that, she can try to get conceived.
So, viewers, please listen to these things very carefully because many women do not have these knowledge. And do these things affect the pregnancy or the child in any way, even if she gets pregnant accidentally? Meanwhile,
No, there is no supported documents available regarding this, but it is safer to take it the vaccine prior. If you are planning to get pregnant, then take the vaccine, give a 1 month period of rest, and then try to
right.
conceive.
Moving on further, what are the symptoms that women often ignore thinking they're just normal, be it heavy bleeding or painful periods, but they are actually bigger problems?
Okay, so menstrual cycles, like I said, to each their own.
Mm-hmm.
So every woman, they are so acquainted with the pattern of the cycles, like the duration of flow, the timing, the amount of flow, and the intensity of pain, that any slight deviation, they can easily pick that out. But they
Mm-hmm.
tend to ignore these things for 2 to 3 months, and after
Right.
that, they try to consult a doctor. So if you're having any heavy pain, and if your symptoms and bleeding is heavy, and you are having excessive blood loss, you are feeling weak and dizziness, then you should definitely get tested, because these can be a sign of, there might be fibroids, that is the uterine tumors, can be endometriosis, that is again a very serious condition.
Mm-hmm.
She can have any kind of malignancy, that is cancer as well, may have cyst, ovarian cyst, that can be a feature of hypothyroidism as well. So many things affect the reproductive life of the woman. So even if something goes abnormal, that should raise an alarm that something is wrong with my body. We need to get tested.
Right. You see, there are so many women who are often told that, if a woman misses her period for a month, or be it little girl,
Hmm.
after they start their period, it is often said that, yeah, give it a month or two, just see if the flow goes back to normal again, then you can go see a doctor. Because I think women often dread to see a gynecologist, especially because, I don't know, maybe it is because of shame, maybe it is because of feeling scared, but they often avoid seeing a doctor. So, what would you say regarding that?
So, women are generally engaged in so many activities. They
Mm-hmm.
tend to neglect their symptoms. They tend to ignore all their symptoms. The only time they take care of themselves is during pregnancy. Beyond that, before
Hmm.
pregnancy and beyond pregnancy, they know nothing. So, starting from, if you are saying a young girl misses her period, So they need to come to us. We need to counsel them. This can be normal, but you cannot ignore these things. This
Right.
can be normal, this cannot be normal. So there is a possibility. You cannot ignore these things. Missing a cycle for a month or two can be normal during the initial phase of your reproductive life, because there our system needs to mature to a certain point beyond which our cycles will be regular. But this can be also hidden signs. There can be hidden signs that something is wrong, like she might be having a thyroid dysfunction, her
Mm-hmm.
hemoglobin might be low, she may be eating less, she is more stressful, she may be munching on outside foods. So we need to take care of that, and we need to address that. We need to counsel them that these are the things you need to do. If you are getting things are not getting normal in next 1 to 2 months, you need to do certain tests.
Okay, so every time a girl or a woman misses her period during the reproductive phase of her life,
Hmm.
she needs to immediately visit a doctor to rule out any inconsistencies in her health.
Oh, okay. So, anytime a girl misses a period in her reproductive age, we first test for pregnancy.
Right.
Okay. Oh, if she's not pregnant, we tend to ask her questions like whether her cycles were regular before that, whether she is taking any kind of supplementation, whether she is working out more or she is not working out, she is totally a sedentary, having a sedentary life. We need to ask these questions,
Mm-hmm.
because most of the time we are seeing these days PCO is so much common, because every 2 or 3 women in 10 women are having PCO like
Right, right.
symptoms,
Yeah.
and their cycles are generally irregular. So they tend to overlook those symptoms thinking that I might be having PCOS. They just Google it and find that I might be having PCOS. So they need to come to us. We can better counsel them and better guide them, that is what is wrong with their
Right.
body. Sometimes when you are having some excessive stress, there is a travel, there is a family function, or you have some illness like you are suffering from dengue and you had a surgery, then we tend to get miss our periods because there is no ovulation and we do not have our periods. But that is normal, that doesn't get repeated in all the cycles. But when the things getting repeated in all the cycles are consistently getting delayed, we need to consult a doctor.
So, what is exactly consistently delayed? We know about delayed
Yeah.
periods of, duration of 40, 42 days,
Hmm.
but what is consistently delayed?
Okay, consistently delayed means cycle can be of varying length in
Mm-hmm.
different people. So starting from 21 days to 35 days is normal.
Yes.
Beyond 35 days, if all your cycles are beyond 35 days, you are not getting 6 cycles per year. If you are not
Okay.
getting 6 cycles per year, that means that you are not having a timely ovulation and your cycles are irregular. Then we need to investigate.
So, are there any other symptoms like these that women often think that it's just normal?
Okay. Most people in their 30s and late 30s and 40s, they experience heavy menstrual bleeding.
Mm-hmm.
So they do not find that alarming. Okay, until they land up with hemoglobin less than 6 or 7 gram%.
Right.
Okay, I'm seeing many patients; those are having heavy menstrual bleeding, and they are giving history that it's been continuing for more than a year.
Okay.
So they tend to neglect that my cycles are like this. So this is not, your cycles are not like this. You are having, your hemoglobin is dropping, you are getting weak, your iron stores are low. So this is not normal. We need to evaluate that. They can take hormone supplements, they can get various investigations done to find out what is the exact cause behind the heavy menstrual bleeding. Okay, first we need to correct their hemoglobin, and after that we can do a pelvic examination. And there are certain conditions like fibroid, that is a tumor in the uterus, and even if PCOS, she can bleed heavily, and they tend to ignore that like my cycles are like this. So that is not normal. You need to take counseling and you need to take appointment.
As we were talking about consistently delayed periods, there are women who often suffer from delayed periods, like their span varies from 40 to even 45 days or even beyond that. So, when that happens for 3 to 4 times a year, that they suffer from delayed periods 3 to 4 times a year, is that alarming?
Yes,
Okay.
if they're having consistently irregular periods, that's what I was saying. That is alarming. Then
Mm-hmm.
why the periods are getting delayed more often in
Mm-hmm.
them? If the cycles are mostly regular, 1 or 2 times she is having irregular cycle, we can understand that due to any stress or external factors. But if the cycles are irregular for 3 or 4 cycles, we need to examine the patient whether what is the factor that is the playing the role. She is ovulating, but not at the time. Might be she is having a sedentary lifestyle, might be she is eating too much over processed foods, might be
Okay.
she is having chronic stress and depression.
Uh-huh.
We need to address these small factors. If these things are getting corrected and she is getting back to her normal cycles, then it's okay. But
Okay.
after correcting and working on self, if she is not being able to go back to her previous cycles like that, then we need to investigate certain factors like serum prolactin, thyroid function test, and blood
Right.
sugar.
Okay. So, ma'am, there is one thing that women often complain about, even my friends. Okay. So, whenever they need to, then whenever they suffer from kind of reproductive health problems, they visit a gynecologist. And the first thing that they're told is about their weight. So, oftentimes patients have this complaint that why is the doctor always talking about my weight? Whether it is my weight loss or weight gain, often a doctor say that you need to gain weight, and then they say that you need to lose weight. Is the reproductive health always related to weight management?
Not exactly weight management, but weight management is again a part of your reproductive health. So staying in a perfect BMI is required.
Mhm.
So if you're beyond your BMI, if your BMI goes up or it goes down, so it affects all your health, including your
Right.
reproductive health. So that is what gets mostly noticed, because your cycles are irregular or you are bleeding heavily. So you notice that and you comfort that, not for others systems. It also affects your cardiovascular health, it also affects your mental health, but
Right.
we do not know that. We
Hmm.
know what is shown in front of us.
Right.
We are facing the problem because of our reproductive health. So when a BMI goes up or down, it kind of regulates all your health, all
Hmm.
your systems, but your reproductive system manifestations are in front of us. That's why we tend to see the cycles are getting irregular. We ask the person to lose weight and all. And mostly because of PCO, which is very common these days, polycystic ovaries, which is very common, and it is strongly linked to higher weight.
Hmm.
Okay, so the weight is on the higher side. PCO, women get PCOS, and when the PCO is there, their weight goes up. So it is kind of a vicious cycle. Okay,
Right. Right.
so weight management is must, but apart from that, what is most important is doing exercise. Staying physically active is most important. Following that, weight management is the subordinate part.
Okay. So, is it okay for the doctors just to say, see the patient and tell them just you go, weight, lose your weight or go gain weight, and then you come see me in a month? Is it normal? I mean, is it okay?
No, no, things need not be said in a crooked way like this. So,
No, no,
it's
it's. I'm not saying that it is in a crooked way, but often patients are told that, and that's why you see women. That there is this. I have talked to many women. You know, before doing this podcast, we just can't go on around and making things that wouldn't relate to people, right?
yeah.
So I have asked around many women, and this is one particular thing that they always complained about. That they're told that, yeah, you need to maintain your health, you need to do this, you need to do that, but I guess what they needed was some kind of assurance or comfort from
Yeah,
that doctor, which they did not get. So I guess this plays a major role in why women also avoid going to
going to
see.
doctors or they
Yes.
switch the doctors.
I don't think they switch the
If
doctors. They just have this. They develop this mentality that
no,
all of
I
these.
am seeing the PCOA patient who are saying that we went to this doctor, she asked me to lose weight, then I came here. Okay, so this is normal with them because wherever they go, they are asked to lose weight.
Yes.
So it can be told in a beautiful way. This is not a way to say that you lose weight, then only your cycles will become regular. So we need to counsel them that this is a long process. It might
Right.
take from 6 months to 2 years, but things will get normalized by that.
Right.
So start something. Unless you start something, you cannot practice that for longer. So
Right.
start something. Start doing exercises and start from little. I also advise them to start like do resistance training. Do not focus on aerobics. Eat properly. Do not skip your meals. Eat properly, but focus on what you are eating.
Right.
Should be a mindful eating. We do not want unnecessary weight gain. Even in thin patients also they are having PC. We cannot ask them to lose weight.
Yes.
We just say them to you maintain your wealth and get engaged in any kind of physical activity.
So, moving forward, when a woman wants to have a child, what are the foundation that she needs to establish before having a baby?
Before having a baby, her health should be optimized. BMI should be within range. Hemoglobin should be normal. Thyroid functions should be normal. Blood sugar should be normal. We should know her blood group and her partner's blood group. She should be vaccinated with MMR vaccine, influenza vaccine, then hepatitis vaccine, and preferably the HPV vaccine. Everything should be optimized
Mhm.
prior that, so that she can go into the phase where she can try for pregnancy, and she must be taking folic acid as well.
So, what are the important markers that a woman needs to check even before trying to have a child? What are the tests that she needs to get done?
Number one, hemoglobin.
Okay.
The hemoglobin should be in normal range. If she is too anemic, we cannot allow her to be pregnant at that time. She needs to correct her hemoglobin level. Number two, her thyroid function test. It should be optimized prior to conception, because the normal thyroid level is what is different, what is that is in pregnancy.
Mhm.
So it needs to be optimized accordingly.
Hmm.
Okay. Next is she should be screened for any infectious disease like HIV, hepatitis B, and hepatitis C. Both she and her partner needs to be screened for this tests.
Okay.
And number four, her blood grouping should be known, and her husband blood group should be tested.
Okay. So, are there any genetic tests that need to be done before a woman starts to plan a child? Because oftentimes children develop genetic issues passed down from their parents. And what are those tests that, especially today's generation of women, that need to focus on?
Okay, so if it's a first pregnancy, there is no such recommended genetic test that she needs to do.
Okay.
If there is some disease or illness that is running in her family and she is aware of that, she can test that.
Okay.
But if everything is normal, she is just like a normal girl who is trying to get conceived. So she doesn't need to do any kind of test beforehand. But if the previous pregnancy was abnormal, if the previous child is syndromic or having any kind of congenital deformity, then she need to test the genetic part.
Okay.
She and her partner both needs to get tested.
Okay. So what are the supplements or food items that a woman needs to take before, during, and after her pregnancy to maintain a particular to maintain a balanced health, so that even after the pregnancy it does not affect her health adversely?
So her diet should be a perfect balanced healthy diet, rich in proteins, iron, calcium, and micronutrients like magnesium, selenium, zinc, vitamin D. So protein she mostly gets from her diet. Carbohydrate, we do not emphasize more on carbohydrates during pregnancy. We want to keep that content little low. Diet should be rich in fibers and in antioxidant rich fruits. Supplements, if you are asking me, I will say folic acid is a must. And I want to pass on this message. Anyone who is trying to get pregnant, try taking folic acid 2 months prior to your conception, because that helps in such a great way that it helps to prevent abortion. It helps in normal development of the baby. It helps in preventing the neural tube defects in the baby. Our diet as such is lacking in folic acid. So taking folic acid 2 months prior to conception is very helpful. And taking folic acid throughout pregnancy is also recommended. So during pregnancy, after pregnancy, she needs to focus more on taking proteins and diet which are rich in iron and calcium. Before that, beyond that also, she needs extra supplements of iron and calcium, because our diet does not provide us enough iron and calcium that is required at the time of pregnancy.
Okay, okay. So, how often women, after becoming pregnant, how often do they need to get their blood test done to know the levels of everything?
Initially, at the booking visit, she needs to get every test done, like her
Okay.
hemoglobin, blood sugar, thyroid, her infectious disease screening, everything needs to get done. And after that, she needs to come every monthly for a checkup. At 4th to 5th month, we need to check her hemoglobin again. At 5th to 6th months, we need to check her blood sugar again, because that is the time when the blood sugar usually goes up. And at the time of delivery, before 1 month to 2 months prior to delivery, we need to reassess her blood sugar, her hemoglobin, and her infectious disease status before the time she goes into labor or we plan some section.
Okay. So, what would be your message for the women who cannot control their cravings during pregnancies? I mean, there are so many women complain about. There are also women who talk about morning sickness,
Yeah.
and how do they manage these things during the pregnancy?
So, the most important thing during pregnancy is having meals throughout the day,
Mhm.
three major meals and three minor meals.
Okay.
Keep snacks ready, and small frequent meals is what acts actually. Taking small bites of food every 2 hourly this is what helps. So what happens in pregnancy, our gastric content, that is our stomach contents, they get digested very fast. So when there is no food inside our stomach, gas builds up. Okay, so they get the feeling of bloating sensation, that they do not feel like eating, and which in turn generates more gas. So they get the symptoms of gastritis. Okay, so they tend to delay further. They tend to take delay further for taking the next meal. So what happens now? By the time they take the next meal, they all vomit out it everything.
Okay.
So this is what happens with most of the women. They do
Okay.
not like, actually the hormone that is related to pregnancy, that is beta hcg hormone, it causes all these things. Okay, and that is a very new hormone that is introduced to us in the first time in the during pregnancy. That was
Hmm.
not in our body, it was introduced to us first time to us. And it does very erratic kind of things. So there is nausea, vomiting, you don't like eating anything, there's taste changes in your mouth, the thing you liked before you do not like that, and you tend to vomit out everything. So the only solution to that is take frequent small frequent meals, and lightweight snacks help a lot, like biscuits, multigrain cookies, and lightweight foods, apple slices, dal, sabji, those help a lot. And avoiding those extra oily and spicy things helps a lot, because they tend to cause more gastritis, more dyspepsia, more nausea, more vomiting. And longer the gap between each meals, longer the severe the amount of nausea and vomiting is there. So it is advised to take little something in between each meals.
So, what about the craving part? You see, there are also women who say that I craved this, I craved that throughout my pregnancy. It was so difficult. So, how do they manage their cravings and still maintain a balanced diet which is nutritious for them?
Okay, so most women, they have a craving for certain things during pregnancy, and it is only I can just explain them that overeating these things are not good. Like some women, they have a craving for mutton during pregnancy,
Mm-hmm.
chicken and mutton. So they have a severe symptoms of gastritis, but they will not be able to control their craving. So this is not in my hands. Whatever you like, you can take, but in moderation. Don't
Mm-hmm.
take much, but in moderation. Moderate your quantities. And if you like to have mutton, but do not have so much of mutton that you do not feel like eating anything after that. Okay.
Yes. So, yeah, another thing about pregnancy is that is it safe for women to exercise during pregnancy? Because you see, there are many women who work out, who maintain a very healthy lifestyle before pregnancy, but once they get pregnant, be it their family, be it their own misconception, they stop working out or they minimize it a lot. So, is it safe for women to work out during their pregnancy?
Those who are already working out before pregnancy must engage themselves in working out. Those who are not working out before pregnancy should not start anything on their own. Okay, and they should, if they are engaging in themselves something in, then it should be a moderate exercise, like a brisk walk, or they can do stretching or pelvic muscle exercises, can do butterfly yoga, they can do swimming also, it is good. But they must not engage in high intensity or high impact exercises like cardio and aerobics. Those have chances of falling and injuring self as well as the baby. Plus it increases your cardiac workload. So not all women will be able to tolerate that. If you are practicing exercises before pregnancy, then you can continue, but you should cut down your high intensity trainings.
Okay. So, are there any particular exercises that might result in miscarriages?
Yes, if you are jumping too much,
Okay. Okay.
if you are engaging in any high intensity training, and if you are, there are much of jerks during first 3 months, the pregnancy is quite naive.
Hmm.
So the pregnancy, the placental formation is still not complete till
Right.
third month of pregnancy. So we need to be careful in the first 3 months. We also advise women to do not engage in any kind of high intensity exercises, do not travel much, because these 3 months are very important for your placental development. Once the pregnancy dislodges from its original position, it is very difficult for the pregnancy to go beyond. Okay,
Okay.
so any high intensity or high impact exercise during first 3 months is not at all recommended.
Okay. Talking more about pregnancies,
Hmm.
what age is actually appropriate for women to have a child? And also, when does the pregnancy become high risk for a woman, depending on her age? And what should the certain age group of women do and know about their when they conceive pregnancy in their age group?
So for me, 25 to 30 is a proper age when women should get pregnant.
Right.
If for some reason it's getting delayed, then it shouldn't go beyond 35, beyond which we call it a high risk pregnancy, because there are certain problems that occur in the after beyond 35. It is difficult to conceive as such after 35. If at all they conceive, then they need proper monitoring and more frequent visits, because they are more prone to develop various complications during pregnancy.
Okay. So, when a woman becomes pregnant at a later stage of her life, be it at beyond 35 age or in her 40s, what are the things that she needs to focus on?
Okay, so beyond 35 or 40, if she is getting pregnant, so she should be always counseled regarding why she is classified as a high risk pregnancy.
Mm-hmm.
Number one is because of her age.
Hmm.
She might develop hypertension and diabetes, which are more
Okay.
common in the later half of reproductive age. Okay,
Yes.
she might develop these things. Number two, her baby, the fetus might be abnormal. We do not know exactly, but syndrome,
Okay.
the chances of having a syndromic baby like Down syndrome and many abnormal babies, they significantly increase after a certain point of time. So
Okay.
beyond 35, the chances of having a syndromic baby is still high. So she needs to undertake all the scans properly. Her NT scan, her TIFA scan, everything needs to be done properly, and she should take balanced diet, and it is difficult for a woman beyond 35 to go into normal labor.
Okay.
So it is easier at 25 to 30 years of age. Beyond 35, she needs frequent monitoring. She might develop complications, she might not. She needs to maintain a focus and a healthy lifestyle, and she needs to do all those tests.
Okay. I mean, thank you so much for saying this because most of our viewers,
Yeah.
I don't think they know about this. I didn't know about this because oftentimes what happens is that women take offense to this, that
Hmm.
who is the doctor to tell me, or who is someone else to tell me
Hmm.
at what age I should be carrying a child.
Hmm.
But I guess the word that you used, counseling, that is the proper
Counseling, yeah.
term for it, because every patient needs to be counseled. They're already scared if they're dealing with something. It's for the first time for
Yeah.
themselves as well, so it's already scary as it is. So yeah, I think
No, it's not scary. We just need to make them understand what is the situation, and what proportion of cases can have this kind of problem. We need to be careful, and we need to do all the tests. So people are scared of why are doing so much of tests. We need to explain them that if you are beyond 35, we can have an abnormal baby. We need to carry out this test to confirm that whatever you are carrying is a healthy pregnancy.
right,
You should be healthy and your baby should be healthy. For
right.
your health, you need to visit me more often, so that I will check your blood pressure, I will check your blood sugar, I will make sure that everything goes fine. And for your baby, I will recommend routine scans so that there is no adverse
Abnormalities.
abnormalities here.
Yes. Okay, thank you. So, talking about high risk pregnancy, what exactly is high risk pregnancy? Is it always does it always mean that something is going to go wrong in this?
No. A high risk pregnancy is something which needs frequent monitoring. Like a twin pregnancy is also high risk pregnancy. Nothing
Okay.
goes wrong in a twin pregnancy always. So it is a high risk pregnancy because there are certain complications that happen exclusively in twin pregnancy that doesn't happen otherwise. Like a pregnancy, a patient with blood pressure is a high risk pregnancy.
Mm-hmm.
A patient with diabetes is a high risk pregnancy. A patient with low hemoglobin or anemia is a high risk pregnancy.
So,
So
age is not a factor in this.
yes, after 35 we call it a high risk pregnancy.
Okay, I mean, I was asking this. See, there are many people who are developing hypertension or diabetes, even in a very younger age, be
Younger
it in
age.
their early 20s or mid 20s. So when women get pregnant during that time, even those are going to be considered as high risk pregnancies.
Yes, yes.
Okay,
Even if she is in the normal reproductive age group, she may be 25 or 21 or something. If she is developing a hypertension or diabetes, she is labeled as a high risk pregnancy because she needs monitoring more often. High
okay,
risk means something can go wrong. Doesn't necessarily mean something will definitely go wrong.
yes,
Something can go wrong. There are probabilities. We are dealing with that. We need to identify that so that when we can stamp the patient as high risk pregnancy, she can go to any other doctor, any other hospital, and she will be given equal importance as a high risk patient. So it is for the patient's understanding, and we need to counsel them that these are the risk factors
mm-hmm.
and why you have got this condition, and why how we need to monitor you, and what are the warning signs or red flag symptoms, so that when the patient gets these symptoms, it is already in her mind that I have this problem, I shouldn't ignore it, because most women, they tend to ignore everything. In pedal edema is swelling is normal in pregnancy. Even if they are getting a swelling, they do not come to the doctor. They they are saying that in my village everyone is getting a swelling, this is normal in
Right.
pregnancy. But they tend to overlook that if you are having high blood pressure and you have so much of pedal edema, that can be a sign of your blood pressure must have gone up,
Yes.
there is some problem. We need you should be aware of your warning signs. So high risk, stamping them as high risk is to counsel them, is for the doctor, is for the patient, and for the baby as well.
Mm-hmm. So, aside pregnancies, you see, women often go, women, not often, women always almost go to the gynecologist only if they're about to become pregnant or they are pregnant. It is always related to pregnancy, or max to max, it is related to menstrual health. So, what are the other aspects of gynecology that a woman should not ignore and go to a gynecologist for those health concerns?
So in the reproductive age, in the adolescent age, women most they tend to have irregular cycles mostly. Sometimes the cycles, they do not get cycles for more than 5 or 6 months.
Okay.
So at the beginning, initially when she is having periods at the time of her menarche, she may not be having cycles for 5 or 6 months, like 1 year. They need to get counsel about that. Beyond that adolescent age group, in the pre-menopausal age group, around 40 to 50 years, the cycles are more frequent.
Hmm.
Cycles are more frequent. They are getting white discharge, they are getting brownish discharge, they are getting spotting, their cycles are coming more frequently. So that aspect needs to be taken care of. And at the time of menopause, they are having symptoms like irregular periods again, and the periods are getting delayed for more than a year, more than 2 years or something. That needs to be addressed. Plus women are experiencing postmenopausal symptoms which they tend to ignore. They are experiencing hot flushes, their bone health is getting compromised, they are having frequent falls and frequent fractures, they are having cardiovascular risk. But they often tend to ignore this problem, that this is normal in menopause, I will be going through this phase. They do not take care of themselves as they take care of others.
Right. Yeah, the women, I guess that they're designed that way. I mean, they're taught even those things that your job is to serve others.
Yeah.
Before you, everybody else comes first.
Yes.
Yeah, I guess women need to focus more on
On
this. And
self.
yes, yeah, I mean, the world is changing and I guess
Mold.
it's healing. Women
Yeah.
are healing.
Women are healing.
Yeah. So there is this thing that you mentioned about irregular bleeding. Yes. So there are many women who also suffer from irregular uterine bleeding. What would you say about that? How often is that risky, and when should they start seeing a doctor? I mean, what if even if a woman irregular uterine bleeding just once, should run to the doctor or just give it a month?
No, if irregular uterine bleeding, whatever you are saying, that's the same as the irregular bleeding, irregular periods, irregular uterine bleeding. So, if it is coming more often, more than 1 or 2 months, she is having intermenstrual bleeding. Apart from her period, she is bleeding in
Yes.
between. She is having spotting in between. That can be normal in 1 or 2 cycles, but that cannot last longer. We need to take the proper history, as in when she is bleeding, what is the type of bleeding like. Is it only spotting, or she is having bleeding just like the menses, or is she having any postcoital bleeding. So we need to eliminate those factors. Plus pap smear is a must. If there is a history of irregular bleeding, pap smear is a must to rule out any local pathology in the cervix.
Beside all of this, what would you say to the girls or women how to maintain their menstrual hygiene as well as the reproductive hygiene?
So this question I get often, because it bothers most of the people. When they are having white discharge, when they are
Yes.
having itching in the private parts, they come to me and they ask what is the kind of reproductive hygiene that I should follow. So my number one advice would be to don't use any over the counter products in your private parts.
Okay.
Okay, so it kind of changes your pH, and the natural organisms, that is microbiome of a vagina, that gets destroyed. Okay,
Right.
so the pathogenic ones can play their role. So we shouldn't use any over the counter things, wash that is available in the market. Plus we should keep the area dry, be it your inner, be it your private part, it should be always dry. If there is any kind of retained moisture, it always drags the organisms. You must have seen the ACs and the refrigerators. when water is constantly sogging and the wall which is sogging and the water is leaking, you can see the fungus grow there. Okay,
Yes.
so when the moisture is trapped in certain area and there is no proper sunlight, the fungus grows. So I always ask them to keep your inner area dry. Use change your inners more frequently, like 2 to 3 times every day, and to dry them in proper sunlight and keep your room airy and keep it well ventilated. Use cotton inners. That is all.
Okay. So, how to keep their reproductive area clean? Are there any particular soaps or body wash that you would suggest?
No,
Or
soaps or body wash are not recommended, just simple water.
okay,
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 soaps and body wash are not recommended. Number one, they contain the phthalates that are endocrine disruptors that can
okay.
regulate their menstrual
Uh huh.
cycles, disrupt their menstrual cycles. Number two, they are irritant. On chronic use, they can lead to dermatitis in the skin itself involved. So these are not recommended. I only ask them to douse with plain water.
Okay. So, what are the early signs of something that a woman needs to be very concerned about related to her reproductive health?
Early signs like if she is missing her period, only it is the only period which she notices. Okay, if she is missing her period, and if there is a lump in her abdomen, if she is finding it heavy in the pelvic area, heaviness, if there is urinary retention, she is not able to micturate properly,
Mm-hmm.
and if there is any frequency of micturition, she might be getting UTIs as well. There might be a tumor inside her uterus. If she is having heavy bleeding and pain during menstrual cycle, or chronic pelvic pain throughout the cycle or throughout the non bleeding days, so that can warn her that something is wrong with her.
What would you say about maintaining the health of a woman's breasts? Because you see, women often feel shy, they feel scared, or any negative emotion when it comes to their secondary reproductive parts. So, what would you say that what are the symptoms or signs that women need to focus on, or how to just in general maintain a good health?
um, most women, they are often ignorant about this.
Hmm.
They do not seek medical advice regarding this, and they do not do the self breast examination, which is number one, the most important thing, should be carried out by everyone.
Hmm.
After 20 years of age, every woman should carry out the self breast examination. She should stand in front of a mirror and keeping her one hand above her head and the other hand just palpate the breast. It should be palpated on the tip of the finger, pulp of the finger, and she will be able to notice if something irregular is there. It just feels like a pebbles in a bag of rice. Okay, so if she is noticing something like that, it is a matter of concern. Otherwise, she needs to take check this every month. This is self breast examination. Apart from that, if there is any discharge, any swelling, any discoloration in the breast, she should take medical advice. If there is pain in the breast, that is known as mastalgia, she should take help, because overconsumption of coffee, tea can lead to pain in the breast. There is some hormonal irregularities that can lead to pain in the breast, and if there is, she is wearing any uh, um, if it is ill fitting innerwear, it can lead to also pain in the breast. We need to address that cause again, and she should not be advised immediate mammography if she is not 40 years of age. That is the most
Okay.
important thing.
Okay. Yeah, women also get scared thinking that they might have developed breast cancer as well. So, how does a woman rule out breast cancer when doing her self breast examination?
So, self breast examination has been implemented to find out the early symptoms of breast cancer. So,
Right.
breast cancer mostly it starts as a lump or a bump. We can feel, I just said it feels like a pebble in a bag of rice. So, she will be able to palpate that, and she will be able to mark its size if it is growing in size or not. But that is a different thing. Whenever you are finding out any lump in any of your breast, you must seek medical advice,
Right.
because there are benign tumors in breast and there are malignant or cancerous tumors in breast. Only it's only the doctor who can tell whether it's benign or cancerous. They can take biopsy from that, and you can also get an breast ultrasound done. But before that, you need to find out if there is something abnormal with your breasts or not. So that's why self breast examination is very important. You shouldn't skip that every month, because if it's a cancer, it doesn't take long to develop into a large bump. Okay, it develops, it grows very fast. Okay, so taking the examination every month will help the woman.
Okay, so another thing I would like to ask you regarding this is that when women often lay down or they sleep and they touch around the breast, they feel lumps. But when they stand and check, they do not feel those lumps. So, is it concerning?
Our breast has glands. Okay,
Yes.
those glands feel like lumps. Okay,
Okay.
so when you palpate with two of your fingers, everything will feel like lumps
Mm-hmm.
because these are glands and stroma, they will feel like lumps,
Hmm.
but those are not actual lumps. When you palpate with your finger pulps only, these are the finger pulps. When you palpate with your finger pulps only, if you find any irregularity, those are the lumps. If you lie down, your breast lies against your chest wall, so you can feel any gland will be felt as a lump. So that is not exactly a lump. You can also do the test while sleeping also. I just said you can do it while standing in front of a mirror. You can also do the test while sleeping, but your other hand needs to be above your head so that your proper position will be maintained and you can feel the masses. If it is any lumpy, bumpy, whatever you are finding, any abnormal thing, you can contact the doctor.
Okay. So it is most preferable when it is done standing.
It is preferably done standing.
Okay, okay. So women often also find lumps on their underarms or around the inner portion of their arms as well. They find these lumps. So are they also a sign of breast cancer?
That can be a sign of breast cancer, but they tend to appear very late during breast cancer when it's an advanced stage. But not all lumps in your underarms are the sign of breast cancer. It can be a normal extension of a breast tissue because breast tissue grows from the underarms till your mid chest.
Yes.
It can be a normal extension that is known as axillary tail of Spence. So it can be a normal breast tissue that has overgrown, and it can also be a lymph node that have swollen because of any infection that you have. It can be a lymph node that has swollen because of metastasis from the breast cancer. So it can be anything. It is the doctor who will rule out what are the possibilities, but it can be anything. Most of the time, if you do not have a breast lump and you have some axillary swelling, it can, most of the time, it is not a breast cancer. In later stage of breast cancer only, the cancerous cells tend to migrate and they metastasize and they deposit at the underarms and above the clavicles, and that is the third or fourth stage of
Okay.
breast.
So when does a gynecologist refer to an oncologist?
Uh, so the gynecologist basically deal with your part that is below your umbilicus.
Okay.
We deal with the uterus, we deal with cervix, we deal with ovaries and your tubes and your vulva, vagina and all the genital parts. For breast, we refer it to surgeons. Okay. In gynecological examination, if we found that there is a early cancer, we can deal with that. If the cancer has progressed beyond a certain point where it cannot be corrected by surgery and the patient needs radiation or chemo, we refer it to an oncologist.
Okay. Moving forward, there are many myths and truths that circulate among women when it comes to their reproductive health. So, what are some of these that you would just highlight?
Number one is you shouldn't do any kind of exercise during pregnancy. You should always stick to bed during pregnancy. So that is not true. You can engage in moderate activities, and going for absolute bed rest is not necessary in pregnancy except certain conditions.
Right.
Number two is do not take coconut water in pregnancy. I don't know why, but this is a very famous, infamous myth that
Yeah.
people are circulating about pregnancy. I asked them, you can consume it daily, no problem. It is rich in electrolytes, has some amount of glucose. It is good for you. This is the second myth. Third, they try to figure out the gender of the baby getting from the shape of the belly.
Oh,
Okay,
yes, yes. That is something that
that is
goes
something
around.
I
Yes.
even I get confused, like what is the flat if boy, boy if flat, and round if girl. I get confused, but they tend to come to me and ask whether my belly shape is going to change, because in my family they are wanting a girl or they are wanting a boy, and my shape is this, so my gender must be this. So that is not related. No, anyhow, that is not related to pregnancy, and that's a myth. And they try to figure out about the heart rate. Okay,
Hmm.
They get me the scan reports, and they are like, heart rate was previously 180, now it's showing 150. Beyond 160 there is a particular gender, below 160 there is a particular gender. So according to them, so that is not true. Heart rate varies, and they get apprehensive that previously it was more and now it's showing less. Does it mean that we do not have a boy, we have a girl? So that's not true. Heartbeat varies, fluctuates when the baby is awake, the baby is kicking, when the baby is sleeping, it fluctuates, and it does not in any way signify that whether it's a male or a female. That
They
is
just
again,
might be having a strong little girl inside.
so that's a myth, and that's
Yeah. There are also these things that women, by their families, they're told that you shouldn't eat non-veg.
okay.
Yeah, during pregnancy, you shouldn't eat non-veg, be it for religious reasons or be it just their beliefs. So, how often does it hinder the pregnancy when a woman is stopped from consuming non-veg? I mean, against her wish or her craving, I'm talking about.
If she is genuinely craving for non-veg, then we shouldn't stop that. Non-veg is in fact rich in protein.
Hmm.
She needs to get high protein. We are recommending protein supplements for certain women who are not taking non-veg,
Hmm.
because non-veg is dense in protein, and she needs protein for the development of muscles of the baby.
Hmm.
Beyond fifth month, her diet should be rich in protein. We are asking them to take 4 to 5 eggs in a week, have milk, have dal, have soya bean. So these are women needs to take non-veg. If she is being forcefully she is being asked forcefully to not take non-veg, so that is not good, because she needs to take non-veg during pregnancy and after postpartum also. Protein is required for the healing, for the immune function, for the development of the baby, as well as the optimal functioning of the mother. So protein is way more beneficial than it looks like. So having a diet rich in protein is what recommended in pregnancy. So if she is getting rid of protein, then it is the problem lies with the family. We
Right.
cannot change that.
Yeah, okay. No, yeah, that's what I was talking about. You see,
Hmm.
there are many families who
Hmm.
come up
Hmm.
and
Hmm.
say that, doctor, you see, isn't there something that we can do? Isn't there something that we can, something else that we can give her to eat
Hmm.
aside
Hmm.
fish or eggs
Yeah.
or chicken?
Hmm.
Yeah, so
They start asking for protein powders. Give her protein powders because we cannot provide her non-veg during this period of time.
yeah,
It is not good to have non-veg during pregnancy, but it's a myth.
huh,
She should take non-veg during pregnancy. If she is interested, she can take, because her diet should be rich in protein. That is the only thing we are concerned about. If she is liking to have non-veg, then she may go for it. And even in postpartum, I have seen most patients, those who deliver after, be it normal, be it C-section, they also often tell me that, madam, please counsel my in-laws, because they are only giving me
veg foods.
veg foods and
Yeah.
very bland foods. And she's like, can't I consume fish? Can't I consume eggs? I was like, why not? Your diet should be as normal as it was before your pregnancy. So I need to counsel their in-laws most frequently.
Yeah, there are two other things that I would like to ask you related to these myths and facts.
Hmm.
You see, there are many families who pressurize women into having a normal delivery,
Hmm.
whether even if the body is not ready for a normal delivery, whether it is not safe for her to deliver the child normally, they often ask the woman to go for a normal delivery.
Even if it's against her
Yeah, even if it is against her wish. I
wish.
mean, there are
Yeah.
so many women who do not want to go through that pain.
Yeah.
I mean, why would you go through that pain when you have this option? It's a
Yeah.
different thing that a woman wants to go through a normal
It
delivery
is
and wants to
totally her choice.
experience it.
It is totally her
Yeah,
choice. It is totally a woman's choice. Plus, if the clinical situation permits her to go through a normal delivery, then it's absolutely fine. No one will force her to take a C-section instead. But normal delivery can only be done if everything is normal. If she has a normal build, her pelvis is adequate, the baby is of adequate size, and there is enough pain or pressure from her. So if everything is normal, her water level should be normal, BP is normal, everything is normal, labor is progressing normally, then only she can have a normal delivery. But many a times things deviate from the normal path.
right.
Situation changes. Pregnancy is very dynamic. Sometimes she is normal, the baby suddenly rotates and it
Yeah,
becomes a breach. The baby's buttocks are there. We cannot allow a normal delivery if it's a first pregnancy. So we need to make them understand that this is not normal. We were planning for a normal delivery. It was in our mind because things were normal at that point of time. So things have changed. So the priority should be the safety of both the mother and the baby. It should not be whether it's through normal or it's through C-section. Your planned delivery route might be changed, but the outcome should be good.
Yeah, yeah. There are two other things that I would like to ask you based on this. Is that people always say that that child was born through C-section, that's why they have low immunity.
Hmm.
That child was born through normal pregnancy, that's why they have higher immunity. Is it true that when a child comes into this world through normal delivery, is it true that they have a higher resistance to diseases because of the microbes present in the mother's vaginal canal?
Yeah, that plays a role, but not significant enough
Okay.
to say that children born through C-sections are having poor immunity. It's not like that. So immunity depends upon multiple factors. It is in your genetics, it is in the food we eat, and after, before delivery, during your pregnancy and after your pregnancy, what we eat and what you supply to the baby, it depends on that. And the route of delivery plays a role, but it is not the major factor playing a role in the development of the immune system of the baby. It has some role, but it is not the major factor.
So, oftentimes, there are many in laws or families of women who go by this myth, or I don't know whether it is a fact. They cover the women. Even if the woman is feeling extremely hot, they want some fan or some AC just to feel a little bit relaxed. People just come and cover them up that no, don't do this, your body cannot heal from this, or
That's a crime. That's a crime to do that. Women often feel much of heat during pregnancy.
huh.
Normally, the temperature is goes up and they are sweaty. They feel exhausted, and we recommend for them to wear any cotton airy cloth. There should be proper ventilation. I ask them to stay in the indoor, inside AC air conditioners for better functioning of both their mind as well as their body. If they are already feeling exhausted from the burden inside their uterus, if you are again covering them with blankets, then we are doing more harm than good.
Ah, yeah, I guess, yeah,
Yeah, this is not.
after a woman conceives her pregnancy, how often she should get the scans or tests done?
Okay. So the first scan is scheduled around 7 weeks. 7 weeks of gestation, to look for the exact date of the pregnancy, to look whether it's a twin pregnancy or a multiple pregnancy or a single pregnancy, to look whether the heartbeat has come or not, or is there any problem or not. So it is the first scan. The next scan is scheduled around 11 to 13 weeks, that is known as the third month scan or NTNB scan. That is a kind of mini anomaly scan where major abnormalities can be picked up. And later on, at the fifth month, she gets tested for TIFA scan. That is the most important scan,
Mhm.
known as anomaly scan, where all major and minor anomalies can be picked up. That is a must. If you are doing only one scan in pregnancy, that should be TIFA scan. Following that, she needs to undertake her growth scans. That is roughly around 8 to 9 months. But again, if she is a high risk patient, then she needs to have those scans more frequently, growth scans, like to assess her LICA status, to assess the blood flow to the baby, and to assess the position and the weight gain of the baby. Weight growth scan can be repeated, but these 3 or 4 scans are must.
So there are many often there are these patients who come with their dream birth plan. So how
Okay.
do you deal with them?
Okay, you should. I just explain them that this is all right. You have a dream birth plan, but I will acknowledge all your disappointments later on, because I do not know whether things will go accordingly or not. We need to re-evaluate the patient again and again. Till the time she has not gone into labor, we cannot assure that whether she is going to have normal delivery, whether she is going to have a C-section. We need to wait till the process of labor to start,
Hmm.
till we can confirmly say that no, you are not going to have a normal delivery. So first thing is to reassure them, to counsel them, and to take them into confidence that this is the problem. Be it me, be it anyone, these are the problems with normal delivery, these are the risks with C sections, and when we are weighing the risk versus benefit, this is better for you. And it is you who will make the decision, and I am with you throughout this. Whether you decide to go for this or whether you decide to go for that, I will be dealing with you, and I am through this, and you have been given a basket of choice, you have to choose. And I my role is only to explain that what is your condition and what are the available choices are. It is you who has to decide, and ultimately it is the safety of the mother and the fetus which matters the most.
Okay. So there are what are the options aside epidural that can manage the pain during birth?
Okay. Epidural is very famous. Like it is given most frequently if a woman opts for labor analgesia. Apart from that, IV painkillers can be given. One nitrous oxide, that is Entonox gas, can be given. Laughing gas, it is known as. It
Ah,
can be given. So it doesn't relieve the patient much like epidural analgesia, but it helps. Apart from that, emotional support is there, and water bath system is there, but we have not popularized it yet in Odisha. But water bath system is there. It soothes the patient, but is nevertheless it doesn't act as an analgesia, but it relieves the stress, the anxiety, and these are all things.
so now we have almost covered a lot of important and happy topics.
Yeah.
So let's move on to a little bit of concerned or a
Hmm.
difficult topic.
Hmm.
It's about abortion or
Hmm.
medical termination of pregnancy.
Hmm.
In our society, it is frowned upon.
Hmm.
Women are not, you see, families, women, their values, religion, whatever it is, women are often told not to go through with abortion.
Hmm.
As a doctor, what would be your opinion on this? How important it is for a woman to have an abortion or a medical termination of pregnancy?
It is based on the again it's a informed decision making. The If the woman wants to doesn't want to continue her pregnancy, it is totally upon her. We do not need the consent of the father as well. We need the
Yes.
consent of the mother only if she doesn't want to continue her pregnancy. There are certain conditions where termination of pregnancy is offered to women. There are certain conditions where she can voluntarily say that I want do not want to continue this pregnancy, but till a particular time it is permitted. Beyond that it is not permitted. In our Indian scenario it is permitted till now till 24 weeks, that is around roughly around 6 months termination of pregnancy is permitted. But by 3 months, if she has decided not to continue her pregnancy, by 3 months she can go to any designated medical termination of pregnancy center. She can get there are legal documentation that we have to fulfill, and she can get this terminated. After 12 weeks we need the consent of two doctors for the termination, and beyond 24 weeks it becomes very difficult to terminate a pregnancy. So multiple people are involved, a board is set up to terminate the pregnancy. And there are certain cases where we ask the patient to terminate medical termination of pregnancy. We ask the patient to terminate because of might be a high blood pressure. When the woman has been throwing fits, or she is going to throw fits, she might go into coma, she might develop kidney failure, she might develop a paralysis. So at that point of time, we need to deliver the baby. We are not bothered about the baby, we are only bothered about the mother. We need to save her first. So it is the pregnancy that is leading to her rise in BP. So if we terminate the pregnancy, then she will recover from that condition. And apart from that, certain cardiac conditions are there, which need termination of pregnancy, like pulmonary arterial hypertension, and a condition Eisenmenger syndrome is there. So these all things need multidisciplinary approach. Multiple consultants, multiple departments are involved, and the woman is informed, her family is informed. A decision is taken jointly, so that it is better for the patient.
Thank you for talking about this. So, are there any medications that when a woman takes it, it is going to affect the baby so
Yeah.
that she needs to stop the breastfeeding?
Yeah, there are categories of drugs, and A, B, C, D, and X categories of drugs. We need to provide them with category A, B, or C maximum. We cannot give them category D and category D X drugs. Those are strictly restricted during pregnancy.
Okay.
Okay, they can lead to congenital anomalies in the babies. Okay,
Okay.
they can developmental issues in the baby. They can lead to improper bone development, improper teeth development. There are certain drugs that harm the baby, so that should not be given. There are particular prescribed drugs for pregnancy.
So, moving forward, there it is often seen that during pregnancy, women who are often healthy, but after they become pregnant, they develop diabetes or hypothyroidism. Is pregnancy diabetes only related to consuming sugar, or it is more than that?
So first I'm coming to diabetes in pregnancy. It is known as GDM, that is gestational diabetes mellitus. So it depends on multiple factors. Number one is genetics. In our Indian scenario, we as such are more prone to develop diabetes because of our ethnicity.
Okay.
Diabetes runs in our family. Okay.
Okay.
So, if women have a genetic predisposition for diabetes, suppose one of their parent is affected with diabetes, then she has a higher chance of developing diabetes in pregnancy. Plus, if she is a case of PCO, she has a higher chance of developing diabetes in pregnancy. It is not related to taking more of sugar during pregnancy that you will have diabetes. But if you are getting diagnosed to have diabetes in pregnancy, you must cut down your carbohydrates. So the reverse is not true. Okay,
Okay.
so it is the pregnancy hormones that lead to insulin resistance. The insulin doesn't act the way it should act. So, pregnancy hormones like estrogen, progesterone, and human placental lactogen, those peak around 24 to 28 weeks. So, it is at that time that most of the women they get diagnosed to have gestational diabetes mellitus. Sometimes it can be managed with diet alone and lifestyle. They need to cut down their carbohydrates. They need to walk more frequently, like 30 minutes of moderate walk. They need to sleep properly, and they to need to reduce their stress and anxiety. In some way it helps, but other for others, if they do not we do not get the desired result, if the blood sugar doesn't come down, we need to put them on oral hypoglycemic agents. And many drugs are not safe in pregnancy. Diabetic drugs are, except for one or two, many drugs are not safe in pregnancy, so we need to switch them to insulin as well. And
Okay.
coming to thyroidism, hypothyroidism is very common in pregnancy, and that is subclinical hypothyroidism, when there are no symptoms but the test report shows abnormality.
Hmm.
Again, which is normal in normal patients, that is abnormal in pregnancy. Normally, TSH level should be less than 5. In pregnancy, we intend to keep it below 2.5 for the proper development of the baby's brain, for the proper metabolic function. So, it might be normal during pre-pregnant state, but during pregnancy we try to keep it further low. So we treat the woman as per subclinical hypothyroidism in pregnancy, and beyond pregnancy they do not need the treatment. Whereas in case of diabetes, if the woman is having diabetes in pregnancy, in next 5 years there is 50% chance of that she might turn into full blown diabetic patient. So it is during discharge we need to counsel them that you have a chance of developing diabetes later on because you had diabetes during your pregnancy. It might be normal now, but you check your blood sugar more frequently, engage in work activities, and do exercise, cut down your carbohydrates and reduce your stress, improve your sleep, so that you do not get it, because but 50% always get it.
Okay. Why staying hydrated or drinking water more often becomes very difficult during pregnancy?
Because it is very important, we stress that drinking adequate amount of water is important in pregnancy. It is stressed that way, and that's why it becomes a compulsion and becomes difficult. So
Okay.
I will first explain why it is very important to drink more of water in pregnancy. At least 3 to 3.5 liters per day is enough. So there is rapid volume expansion. Blood volume expands in the mother, in the fetus, in the placenta. So to accommodate that, we need more water. Second is our metabolic need increases. Third is to prevent UTIs. In pregnancy, urinary tract infections are very common. To flush out the organisms, we need to have more water. It becomes difficult because we are advised to take more often water. And it becomes difficult because in the early half of pregnancy, we tend to get more nausea and vomiting. And drinking water makes us full and we do not want to eat anything. Plus, we get midnight wake up calls because of our full bladder. So they tend to, so it is hard for taking water of that much amount during pregnancy,
Hmm.
but it
Okay.
is required. And it maintains the amniotic fluid volume also. The amniotic cavity inside which the baby lies, it is somewhat dependent upon the water intake of the mother, partly dependent.
Okay. So there are often women are seen wearing smartwatches, especially during pregnancy,
Hmm.
to monitor their heart rate or blood pressure. So are they actually helpful, or do they cause more stress to the woman?
I think they cause more stress to the woman because they raise false alarms. In general, in pregnancy, heart rate goes up. Okay, so they do not recognize that and they raise false alarms. The there is panicky and the woman gets stressed that why is my heartbeat persistently so high, but it is normal in pregnancy. But apart from smart watches, I would recommend they should have a blood pressure monitor at home. If she is diabetic, should have a glucometer at home. These two
Right.
things are must, and she must be checking her weight regularly. So
Okay.
these things are must.
Okay. So there are many taboos that also revolve around pregnancy, and one of them is intimacy between couples. So when should couples stop being intimate when a woman gets pregnant?
For first 3 months, there should not be any kind of intimacy
Okay,
because the pregnancy is still in a very vulnerable stage. It might dislodge. The pregnancy might dislodge inside the uterus because that's a jerky movement when they get trying to get intimate.
right.
Plus, if it's a high risk pregnancy, if she has episodes of bleeding, spotting, white discharge, there is chance of preterm labor. If her cervix is small, short, if the placenta is positioned quite lower, then she must not engage in sexual activities at as it may increase the chance of bleeding, increase the chance of she might be going into labor. There is increased chance of infection as well. If she is actively leaking or there is white discharge, then she should not get engaged in these things.
Okay. During pregnancies, women gain weight because of bearing a child and because of fat layers forming in their body. They're usually shamed, be it during pregnancy or postpartum. How do you talk about weight management with a patient when they're often you see, you cannot know about background of every patient. They, I don't think they would be coming, they would be opening up that much as well. So how do you talk about weight management with a patient while being respectful and not stressing them out?
I just start with what is the minimum weight gain you need to have during your pregnancy. So that helps them out. So this is the minimum weight gain that is around 7 kgs. Almost all women. I ask them this is the minimum weight gain you should have during pregnancy. This is for the optimum functioning of your body, your mind, and for the optimum development of the baby. This is
Right.
must. Focus on which foods, focus, ignore which foods, and you cannot take this and this. I just list out the things. So it becomes helpful that I am not, the pregnancy is ultimately having a good baby, and the pregnancy should be uneventful. It is not a thinning process.
Hmm.
So those who are on the higher side of the weighing scale, they should not get stressed. So it is not, it is a normal thing that you are being pregnant, and for you, as your BMI is on the higher side, the minimum weight gain requirement is this, the maximum weight we can permit you to gain is this. So focus more on protein intake and don't eat too much of carbohydrates, and the weight gain, whatever you are gaining now would be, you will be getting back to that normal after the end of your delivery. So it is just, we just counsel like this.
Okay. So there are many women who, I mean, most of the women, I guess, after pregnancy, they tend to stay on the heavier side.
Hmm.
So, how would you counsel their husbands or families to be kind to them? You see, families tell them that in our during our pregnancy we did this, during our pregnancy we did that. Why can't you
Scenario
do
has
this?
changed, the
Yes.
scenario has changed. We are not you are not at the same, we are not at the
Yeah.
same time. The scenario has changed. Now she has to manage multiple things.
Yes.
Previously she had to manage only home, but now she has to manage her family, her career, her job, and it is not possible, practically possible for a woman to take care of everything after she has a baby. So I ask them to take it easy, take it one step at a time, but start doing some kind of exercises after your 6 week of pregnant delivery, that is around 1.5 months postpartum. She must engage herself in some activities, but she should be gentle with self and don't stress out. It is a, like, it is a emotional support from the family that helps her regain her confidence that I can also do, I can manage my weight. And it is not only the doctor that helps the patient out, it is more of a family
Right.
issue that that needs to address, they need to address that. So she has multiple responsibility now as a mother, and she is also recovering from her postpartum period. So a healthy pregnancy doesn't guarantee a healthier postpartum. So postpartum period can be normal for most of the women, and it can be also abnormal. She might be having postpartum depression, she might be
Right.
her anxiety, she is sleep deprived, and she has been feeding the baby, she is lacking the calories, and that's why she is munching. So it is very important to understand, it is more of the counseling of the spouse and family members rather than the patient itself.
Right.
So they need to be counseled that these are the requirements. She needs more of emotional support rather than emotional support. She should be provided good calorie food. She should be provided space for her own recreational activities. She should be provided space to go outside the family and spend some quality time with self.
Yes.
And that's it in some way helps the woman cope with the situation better.
So, what would you say to the family? I mean, you see, when they stress her out that why aren't you doing this? Why aren't you doing that chore? We used to do that.
It's basically at the time of discharge when the patient is getting discharged. I know that this is the probably the last contact I am having with them.
Hmm.
So I ask them to come for a follow up, bring your mother-in-law, bring your in-laws with you. So I need to counsel them that this is a very important phase. She needs to be taken care of, the baby needs to be taken care of. But if the mother is not happy, if the mother is not in the sound health and mind, she will be not be able to manage her baby properly.
Right.
So it affects in various ways. So it is more of emotional support that is the in-laws need to be counseled about. So I always ask them, probably this is the last contact, but you please come back to me after 1 or 2 months, so that I need to talk to your in-laws, I need to talk to your family, that how is things going on. Some people, they are very happy after they are not affected by the postpartum blues, psychosis and depression and all. But for some, there is some
Okay.
emotional burden and emotional factors that play a very significant role. One side, she is recovering from the pain and suffering of the delivery process. She is bleeding, she is lactating, and the she is sleep deprived, and she is in charge of a tiny human being. So this is too much for a woman to handle. There's sometimes outbursts, they have outbursts,
Right.
and it
I
becomes
guess those are just valid crash outs.
no, those are valid, exactly.
Yeah.
So anyone who has gone through that phase can address that issue more. But it feels strange that people like in-laws and all, they do not recognize those problems. Like, we were not having any kind of psycho depression and all after that this new generation is having, but they
Yes.
tend to forget that we are not used to that kind of lifestyle. We were free and independent till that baby is baby till
Was
the baby
born.
comes, huh?
Yeah.
Till the baby comes, we are free and independent, and now we are stuck. We cannot go outside. We are asked to eat certain type of food only. We are asked to even one of my patients was made to sleep on the floor only,
Oh
because
yes.
because of a taboo she cannot sleep on the bed till the
Yes.
12th day of her pregnancy. When she came back to me again on the 10th day for removal of her stitches, I found out that she was complaining of heavy backache. Why are you having black backache? Because I am not getting a support to sit down while feeding my baby. I am sleeping on the middle of the room, and that doesn't have a wall. So it becomes
My
uh,
God.
I was so sad to hear that. I counseled the husband, this is not fair. It becomes difficult even to get up from a bed. So how much difficult it would have been for the lady to get up
Yeah.
from the floor every time she needs to go to washroom or change the diapers, change the clothes. Baby and mother are sleeping on the floor. So these are the taboos that family needs to address. That we as a doctor can only counsel them, but we kind of lose the contact once the baby gets delivered.
Hmm.
So we can assure at the time of discharge, but after that what happens, it is in control of the family itself. The woman needs to raise their voice, and the partners, it is the role of the partners that they need to be supportive
Yeah,
and
it's
all.
true. I mean, it's very painful. I mean,
It's painful,
even
yeah.
just imagining letting a woman
She's
sleep on the
having pain,
floor.
she's bleeding, she's lactating, she's having pain, she's sleep deprived, she has gone through the whole process of labor and delivery, and she's still sleeping on the floor.
Yeah, I mean, women are held in such high standards when they're pregnant,
Pregnant,
and
yeah.
after
That,
after the pregnancy, they're. I mean, I don't know what to even compare them with.
yeah.
They're treated with such bad. I don't actually have the word, to be honest. It's very painful to see that.
But this the scenario is not same everywhere. But
Yeah.
most of the, I am seeing variety of patients. Some are very happy. They come back with a wide smile that we are very happy and my family is very cooperative. I'm not getting to do anything. I'm only engaged. I'm getting time with my baby and all. But we are seeing society is different. All are
Yeah.
different. We cannot complain.
Yeah. Yeah, I guess I would just request every viewer to be kind to any woman that has just given birth or is going through her pregnancy or is trying to conceive. Please be kind to them. Give them what they want, give them the space that they need, give them any help that you can offer. Okay, so moving on, as a doctor, how do you deal with patients, or how do you deal with them emotionally when they have just have it, when they wanted a pregnancy but just had a miscarriage?
Okay, that's a very difficult situation. So they need time. They need my time, and I need their time. They should be in a stable space. We need to discuss that. I just ask them to come to me, and we need time to discuss. I ask both the partners to come and try to explain them patiently that this has happened. And when they get to know that, how many cases, how many percentage of women tend to have abortions in their first pregnancy or second pregnancy, they get somewhat reassured that we are not the first one, we are not the only one, people are
Hmm.
getting this problem. So what are the cause of this problem, how this can be addressed, how what can we do to manage this, and when should we plan our next pregnancy. If we are explaining them everything patiently, then they kind of get reassured that I am saying them, you come back after 2 to 3 months. We are in this together. Next time we will look for these factors. Probably this has happened in your case. We will watch out next time. You do not worry. You have ample of time. You are still in your reproductive age. You can get pregnant anytime. You can get pregnant any number of time. So you can come back to me anytime after 2 to 3 months. Get some space, get some do some exercises, and stabilize yourself, and come back to me after 2 to 3 months prepared, and we were in this together, we will make this happen. So that's the kind of positive reassurance we can only give them. That is what helps, and they tend to hear it more often from their treating doctor itself.
Okay.
And when the parent both the partners are together, so it becomes easier to explain them.
So, as everything should come to an end, we
Yeah.
have also reached the end of our episode. So, before ending this, I would like to ask you one last question.
Yeah.
Is that what would be your golden advice to every girl, every woman that is watching our podcast that that they should implement in their lives?
See, women are so busy. They are so busy throughout the day. They are already multitasking. They are managing so many activities. They hardly get time for themselves. They hardly do exercise. They hardly manage their diet. They are
Right.
always in a hurry. So, and the only time they take good care of themselves is during pregnancy. So, my message is loud and clear. Womanhood is beyond pregnancy. You should prioritize your well being during all phases of your life because your health is your foundation.
Okay. Thank you so much, viewers, for staying connected with us. Today, we discussed about gynecological health. Next, we will bring you more such topics. So, let's thank Dr. Samikshya Nanda for joining here with us and giving us such insightful information. Thank you. Stay tuned and take care.